and welcome to Global News 6. My name is Jordan.
And I'm Rebecca.
Tonight, we have a special program on global aphasia and its signs, symptoms, and treatment.
And later, we will have a special report with speech-language pathologist Miss Amanda Hall, who will give us her interactions with this population. And now here's Anna with the special report.
So a stroke is what usually precedes aphasia in most of the patients we see. 10 to 40% of all strokes result in global aphasia. And the general public really isn't even aware of this fact. The signs and symptoms of all types of aphasia vary from each one, but for global aphasia, there's three main key components that we need to look for. The patient cannot comprehend information, the patient cannot repeat information, and the patient is non-fluent when speaking. To explain this further, all of their language modalities are impaired and the patient just has minimal speech output. On our aphasia team, Danielle has more to explain on what areas of the brain are affected. Back to you, Jordan.
And now we take you over to Danielle for the explanation of the localization.
Before we begin, we must first orient ourselves to the brain. This is the left hemisphere, and this is the right hemisphere. As with most aphasias, a stroke typically occurs somewhere in the left hemisphere, causing various deficits. Global aphasia in particular causes damage not only to the frontal lobe, but the temporal and parietal as well. Because there is so much damage done to the brain tissue, the prognosis for these patients is typically poor. However, some patients can recover function over time with the help from various medical personnel.
One in 250 people in the United States currently have aphasia. Think of how many people that could be affecting someone in the community of Beebe, Arkansas, with 8,100 people. Tonight, we're going to ask people in the community who they would call if they were given that diagnosis. I'm here with Jamie Wernicke of Beebe, and we're going to ask her who she would call if she was given the news today that she had aphasia, a language disorder, following a stroke. Jamie, who would be the first person you would call for help?
Probably my primary care doctor.
Okay, thank you so much. Now I'm here with Mike Broca of Beebe to ask him who he would call if he was given the news of aphasia. Mike?
I would rely on my neurologist.
Okay, thank you. This is Natalie Henley reporting live for Global News. Back to you, Rebecca.
We have breaking news from the President of the United States. Here's a live look at what President Schmitz is saying.
Citizens of the United States of America, I now pronounce June to be Aphasia Awareness Month. Thank you for this message.
Wow, that is impeccable timing. Happy late Aphasia Awareness Month. We now take you to Miss Michaela Forsyth, interviewing a client of hers with global aphasia. Michaela?
Thank you, Jordan. You may now know what aphasia is, but what does it really look like in the day-to-day lives of those patients? I had the opportunity to speak to a recent stroke patient who had acquired global aphasia. Due to the ongoing pandemic, we spoke virtually, but I spoke to Natalie Henley in her nursing home room about her day-to-day struggles. Here's how it went.
Hi. Hello. What's your name?
What?
What's your name?
Oh, Natalie. Hard to say sometimes.
Hi, Natalie. I am Michaela. It's nice to meet you.
Yeah.
So, Natalie, can you tell me how long ago you had your stroke?
Uh, 6.
6 months?
Yeah.
Now, where are you?
Do I know who it is?
No, where are you?
I am at my new place, new home.
Yes, it looks like you're in your room.
Yeah.
Natalie, can you tell me how your life has changed since your stroke?
Stroke, yeah, it's hard, and it's hard to say, but hard to say and takes a long time. Yeah.
Okay. Well, we thank you very much, Natalie, for sharing.
Yeah, thanks,
As you can see, Natalie struggled with both understanding what I was asking and with the words she wanted to say. After the interview, I had a chance to speak to her caregiver, her husband Brody. He stated that the biggest struggle is communication because it plays a role in so many other things. Whether she's hungry or not, whether she's hot or cold, if she's comfortable, tired. Communication plays a big role, and that was the biggest struggle. This is Michaela signing off. Back to you, Jordan.
When consulting the doctor about the patient's progress in her aphasia treatment, he responded with, "Hard to say."
That is such a great insight into someone who has to live with this disorder daily. Now we take you to speech-language pathologist Miss Amanda Hall to discover the treatment for this disorder.
Thank you guys so much for having me. So as you mentioned in the beginning of the program, people with aphasia often have difficulty with language. So their speech fluency, or how connected their speech is, their language comprehension, their ability to say common words like the days of the week, and repetition, recalling words, and often grammar. And typically a person with global aphasia has difficulty in all of these categories, as you saw with Ms. Henley. So in other words, they have trouble taking in information as well as getting information out. But the level of severity in these patients vary. So some patients may be able to say a few words like yes or no, and some may not be able to say anything at all. So during therapy, we try our best to use any preserved skills that a patient has and build on top of that. So for example, if a patient has some gesture use, we can use that to work on another area of language. Most of our patients are willing to participate in therapy, but many times global aphasia has an emotional effect on them, so we try to include their family members as much as possible in education and goal setting. Today I have with me Maria, and we're going to demonstrate an auditory comprehension task that I might do with the client. Maria has global aphasia, but has good gesture use and understands the answers yes and no. So we're going to use that to our advantage today. Okay, Maria, I'm going to ask you a question, and I want you to point to the card for your answer. We have yes and no. Okay, let's practice. Is your name Maria? Okay, yes, your name is Maria. Good job. Let's try another one. Do you live in Conway? Great. Is your husband's name Bob? Good job. Is your husband's name Matt? Great. So as you can tell, this activity works on her auditory comprehension, her gesture use, and encourages her to use yes or no answers. So I would bring in her husband and her other family members and also show them how to use yes or no questions to help communicate with her. Thank you guys again for having us today.
Well, this concludes our episode about global aphasia. We hope you learned some valuable information. If you have any questions or comments, please contact us through our Facebook page, Global News. Happy Aphasia Awareness Month!
And remember, if you're at a loss for words, it's just aphasia. Thank you and good night.